Hello, I'm Sarah Clark from Fab Fertile. So today I wanted to talk about how to not waste time, especially when you're dealing with low AMH and high FSH. A lot of times people ask me, what is the fast track? And really looking at the functional approach is the fast track to help you get pregnant naturally, or if you do need to go to IVF, you'll improve your chances of pregnancy success. So we see a lot of people wasting time by taking generalized recommendations, either doing fertility superfoods, fertility teas, fertility, like there's a whole bunch of recommendations out there that are generalized guidelines, following podcasts, following books, following blogs, all these generalized recommendations. Our thing is really to use functional testing. We have access to functional testing, and we look at food sensitivity testing using blood, stool testing, looking at the DNA of your stool, hair tissue mineral analysis testing. So, and making sure that you're actually absorbing the nutrients from your foods. We see a lot of people that are eating that healthy, organic, nutrient dense diet, but maybe they're not absorbing all the nutrients from their foods. And then also we're doing hormone testing using urine. So we're looking at those four tests, and that really then helps us develop a protocol. So it's right for you. We've had people, when we do the food sensitivity testing, there's no perfect food sensitivity test. It's a snapshot in time. But really, we've seen people intolerant to lettuce. So you could be having, with the fertility superfoods, maybe you're taking a whole bunch of avocados, like I used to do. I'd do tons of avocados and did a food sensitivity test, and avocados were off the chart. I was very intolerant to them. Again, as I worked to heal my gut and really deal with, because I was on antibiotics for years for different infections I had. I was on birth control for years. So then I developed a leaky gut or intestinal permeability. So those favorite foods that I was eating all the time, the body mounted an immune response to it. So the generalized recommendations, although some of them can be good, they worked for someone, but are they right for you? So it really is important to take that personalized approach using testing. So test, don't guess. Then you can fast track your success. So looking at the functional approach really is the fast track, especially when you're dealing with complex cases like low AMH, high FSH, so diminished ovarian reserve, premature ovarian insufficiency. And really, it's not just a diagnosis, and we myopically focus, when we get that diagnosis, I know I did, when I was diagnosed with premature ovarian insufficiency, I, focused myopically on the diagnosis, didn't look at any of the other health issues that were going on in my body. So the generalized recommendations can really set you back, and you may feel like you've tried. Most people that come to me, they've tried heaps of things. Like they're on heaps of supplements. They've made the dietary changes. They've done all kinds of things. They've thrown out the plastics, done all this stuff, but it still hasn't worked. So really taking that targeted plan using, when we have access to the testing, using testing, which we ship worldwide, can really help fast track you. So definitely you can click on below, check out our Fab Fertile method, see if it's right for you. And if you want to book a call, we can chat. Take care.